We had a new addition to practice.
It's just so weird. I'm going back home.
You don't like it?
I hate it.
You do.
They're like bad emojis. Stop petting my patients with those.
Oh, he likes it. He's so sweet. You just want a little fist.
I don't want it.
Oh, and you're no fun. Oh, I wish I had a little glass of wine.
Like, I hate these little hands.
It's okay. Just relax. Just relax. Just let me give you a pat on the shoulder. You're doing a good job.
Thanks so much.
It's like, you know, if you can't make work fun, why work?
I was already having fun.
Oh, is that itchy?
I'm Dr. Joya, and skin is my specialty.
Oh, your skin's peeling off.
When a mystery pops up, that case comes to me.
Let's start looking at you.
Things are looking better. This job can be sticky, gooey, and stinky. Ew. But I love every moment of it.
I love this. Amazing turnaround.
All right, Coco, let's go. Good job, good girl.
Coco loves new people. It's almost like she wants to see how much attention she can get from a new person. She looks at you with those eyes and you just want to give her what she wants. She's a great, great, great dog.
Good girl.
When we first got her a year and a half ago, she had heartworm. She was very lethargic and we weren't sure what was going to happen, but the medicine worked. Coco got over the heartworm and I made it a goal to get back her cardiovascular energy. So we went hiking every day. Little by little, Coco has regained her energy. She's come a long, long way.
Yeah, good girl.
But after about a month and a half, we saw that Coco had like a big bubble on her head.
Hi, Coco.
All of a sudden, we were petting her, and you can feel that bump, yeah. The vet said it actually was a cyst.
Yeah.
And that it would keep growing until we got it aspirated.
Yeah.
Instead of going to the vet for the rest of her life every month to get this aspirated or potentially having it pop on us, I'm hoping that Dr. Joya can remove the cyst and Coco can live her life without having this big ball on her head.
What's the fluid inside look like?
Clear.
Clear, yeah.
My fear is that it'll turn into something cancerous.
The biggest thing would be to just get the whole cyst out,
Okay.
just so that it doesn't fill back up. Because if you leave some of that cystic lining, you could potentially end up regrowing a tumor later.
Okay.
Good news is that most of the time, these are benign tumors, and it's just good to get these things taken off just so you don't have to worry.
Exactly.
All right, Coco. We'll be right back. There you go. She's really chill.
Can you sit? Oh, that's a good girl.
This mass, Mom is describing it as having clear fluid, so I think it's a sweat gland tumor. Those are always fun.
Where's your vessel? He's a big dog.
They deflate it fills back up, they deflate it. It's like Groundhog's Day, you know. So you might as well just get that out.
There's your sweet drugs, little mama. Are you sweetie?
Coco's a big girl.
117 pounds.
We have a little office tradition that helps us determine who gets to do the honors of lifting her onto the table.
Paper, rock, scissors.
So we gotta lift this dog.
Do I ever lose? I always win.
Feeling strong? Oh, Coco, you're cute.
She is cute. See how big this little cyst is.
This mass looks like a typical sweat gland tumor. These are benign, they're not cancerous.
See how it looks kind of translucent?
But if it were to rupture and get infected, it'll create a problem for Coco, so I'm gonna take it off today.
It's like a balloon filled with water. There's a bleeder. Ah!
I got you.
Gotcha. There it is. Just took a unicorn horn off.
Say goodbye to your little friend.
Coco's mask came off just fine, and now we get to cut into it.
Oh, a little bit squared up. A little fluid came out. It was a sweat gland tumor. See the little holes in there? It actually is pretty.
Joya finds the beauty in the nastiest things sometimes. We got that thing off, and I'm sure Coco feels a lot better.
It won't come back since I got all of the cystic wall. It's gone. Gone for good. Gone for good. You're all done. All right, Coco, let's go. There's Mom. Mom, I was so groggy.
Hi, sweet girl.
I do think it's a sweat gland tumor. You know, I was able to get the whole capsule out, so it will not grow back here.
Thank you so much. This is
You're
such
welcome.
a relief.
Uh-oh.
She's like, while you guys talk,
I'm gonna take
just
another nap.
Yeah, I'm just gonna take a nap right here.
Coco.
Could you bring me a water too, please?
Coco doesn't really want to get up. I think she wants to stay with us. I sort of have that effect on animals. Or maybe it's the sedation.
Good job.
Motivation for you. All right.
That's right. Okay, let's go. All right, yes. Legs feel very heavy, I can tell. I feel really relieved. Our quality of life has just risen because we don't have to worry about the bump on her head and going to the vet every single month for it. Yay, we did it! You're out!
Are you ready, Maggie? All righty. I've brought my dog, Maggie May, to get a mass removed. It's a 2x2 mass that's just growing right out of her belly, so we need to get that taken care of.
She is cute.
Yeah, she's my baby. This morning, she would not come to me. She does not like to go to the vet. She's like, put her head down and she's wagging her tail. You know, she knows something's going on. She's smart.
You have Miss Maggie.
This is Miss
Look at
Maggie.
your ears.
She looked like a gremlin when she was little. She had real dark ears, and she would actually fit in the palm of your hand.
Oh, so you've had a long life.
She was 5 weeks old when we brought her home.
Nice.
From the get-go, Maggie, she was attached to me for some reason. Oh, my Maggie. Oh, my Maggie. Maggie, she'll follow me everywhere I go. She has to be right in my lap. If I take a little trip, she will want to go outside every 5 minutes to see where her daddy is. She just cannot wait for me to come home. Hey, Maggie. Hey, little girl. I never expected for me to love her as much as I do. She's pretty special. Ain't that right, baby? Here in the past couple of years, she's developed a growth underneath her belly. And it wasn't too concerning. We took her to the vet, and they said it was okay. But here in the past few months, she started scratching it, and it's starting to cause a problem. She's licking on her sore right now. She's breaking it open when she scratches it. Her legs are getting blood on them. You know, she whines and cries, and so it's breaking my heart. I would love to have her around for another 5 or 6 years. We love her that much that we're willing to do whatever we have to get her fixed up. I know, girl. You get that old thing taken care of.
Well, let me take a look at this
All right.
this thing for you. Hi, Maggie. Well, that's pretty big, isn't it? It's very firm. Oh, I know.
We're real afraid it's going to get real infected because it's just not healing up now.
Yeah, I mean, it's got a little ulcer in the center of it. It's probably just gotten so big. When that happens, they don't heal very well.
I don't know what's going on with Maggie May yet, but the look of this tumor is very concerning.
We'll take her in the back, and then
Okay.
we'll get taken off for you, hopefully.
All right.
The way that this tumor looks, the way that it's firm, the location of it, and the ulcer on it has me concerned that this is something more serious.
We're gonna take this giant tumor off this tiny little dog. I think it weighs about 10% of her body weight. It's very firm. I don't know if it's a form of mammary tumor, because there is a nipple right there. So it could be like breast cancer.
Maggie May's a Chihuahua, which they are more likely to get mammary carcinomas, and the fact that she's, much older, both point me towards this being something cancerous.
Try to make a little elliptical incision around this. There's a lot of free skin, which is nice. Uh-oh. It's like an eyeball coming out of here. It's gonna be like an eyeball. There it is, it's coming. You ready? It's gross. All right, I'm gonna close the skin now.
I was able to remove all of Maggie May's mass cleanly, and because this looks suspicious, it's really important that we get all of it out completely.
Oh! It's very gnarly. It's got a lot of little bumpies on it. It doesn't look good. Yeah, this looks like cancer. See how this tissue is like all normal? See the difference? This is benign tumor, likely cancer. It's pigmented. Like this is all clear, it's fairly organized.
I'm really concerned that Maggie Mae's mass is cancer, but there's only one way to find out, so I have to send it out for histopathology.
I know you've been patiently waiting for her.
Hey, Maggie.
How are you? Say here I am,
Good.
Daddy. Everything went fine.
Okay.
It came out, it did look abnormal. I cut into the center of it.
Yeah.
Yeah,
You gotta,
so
you gotta check it out, don't you?
we're gonna send it out.
Yeah.
We'll send it out. Yeah, so we'll know what it is.
Okay. I'm really scared it's gonna end up being cancer, and that would absolutely break my heart.
Those stitches can come out in 2 weeks.
Okay.
Yeah, and then we should know back around that same time, if not sooner, about the mass.
Okay. I hope it's nothing, but if it is, we'll have to deal with it.
Hi, Maggie.
She's like, okay.
Cause she's just like a little kid to me. They become your family. You want them to be able to stay around as long as they can. All right, Maggie, let's go home. You're gonna feel a lot better.
Are you the best boy? Would you mind putting him on the table for me?
I don't mind at all.
Ooh, you're so cute. I'm gonna check his paws. There's some gunk in his paws. Good job. Good job. We got tail wags. Here's the cheese. I hate calling it cheese. You're doing your best. Like, they shouldn't have that white material in between. I'm getting discharge all over my hands. Why you got all this in your toes, bro? Angry, allergic paws. My hands are like covered in discharge, and I'm unhappy about it. I would like to wash my hands, please. Discharge from between the toes. It's fine. It's great. It's gonna be great. Okay. I feel new. I feel better. It's a part of the job.
We have two dogs, a female boxer named Sadie and our French bulldog named Natty. Natty is our baby. She's just a fun-loving, just a very, very outgoing dog. I should.
Natty's only 3 years old. She should have a happy, healthy life at this point.
Sit. But now Natty has this terrible skin problem. Natty started losing hair around her face and ear area. And then Natty started to really itch. And then it went from itching to scratching to more hair loss and the scabs and lesions.
All her little sores. She's not herself. Her personality is different.
Natty was a wild child. You could not keep her still, wanted to play with her balls and Sadie all the time. Now, she doesn't want to do anything but just lay around and sleep. Not my little girl that she used to be. As a vet tech, I've seen many different animals with skin problems and stuff like that, but I've never seen one as bad as Natty. We've taken Natty to our personal vet, and we've tried different shampoos on her.
Little baby. Oh, he's great.
Natty's been on multiple skin antibiotics, steroids.
And nothing really seems to help Natty out. It makes you feel helpless. Natty means the world to us. I'd bend over backwards for that girl. We're just hoping and praying that Dr. Joya can get us in the right direction to fix it.
Oh my goodness.
Come
How
here,
are
Natty.
you guys? So cute. Now look at her little corkscrew tail. Oh.
You just got the saddest little face. It's like a sphinx in a dog body.
Yeah.
You do look like a little sphinx.
Natty doesn't have any hair, so this onesie is protecting her skin. It's keeping her warm, keeping her from sun damage, and preventing her from scratching herself. And it's also super cute.
Where did all your hair go? What happened to you? Your hair's gone, you got these crusties on your skin.
See this right here?
That's what color she used to be.
She was a little blondie,
All
reddish
over.
blonde.
Yes.
So she looked normal at one point with hair and everything,
Oh, yes.
like a normal dog.
Yes, all over.
Interesting. Is she itchy now?
Oh, God, yes.
She's very itchy. Okay.
Yeah.
Her foot pads are really thick
Yes.
too. How does she feel overall? I'm sure she doesn't feel good.
No, she's not her normal self anymore. She pretty much just lays around and sleeps now.
So I see where they did the biopsy.
Yeah.
And it showed inflammation in the skin, basically, and some infection, but they didn't come down on any specific disease process, so that's kind of unfortunate for us.
Natty is a tough case. Her mom and dad have done everything right. They've had her biopsy, they've put her on antibiotics and steroids. They've done everything that I would have done, but it seems like we're missing something.
Blood work was fine. I mean, everything else, biopsy, blood work was good, but still no definite.
Yeah?
The inconclusive biopsy results really don't matter because the fact is that Natty's just not getting any better. So I have to figure out what's going on so we can help her.
I just want to get my girl back.
We're gonna help you. This poor thing. We'll get you feeling better and looking better. I think this is probably autoimmune disease. Were there ever intact pustules on her
Yes.
skin? It looks like pemphigus, which is an autoimmune disease that can affect dogs. The crusting that she has on her feet is really consistent with pemphigus. They'll get these really hard pads. And in bulldogs, it causes this really thick, kind of yellowish crusting like she has on her body.
Pemphigus is an autoimmune disease where the body will attack the attachments between the skin cells. And even though Natty's results were inconclusive, she looks just like pemphigus, and my experience is telling me that this is what it is, even without having to repeat the biopsy.
What we're gonna do today is take a look at these slides from underneath the little crusties and see if we see any of those cells suggestive of pemphigus.
Without a definitive diagnosis with the biopsy, I'm taking some samples of her skin to look at under the microscope to see if I see some suspicious cells that we typically see with pemphigus.
I see a lot of eosinophils, which is often seen with pemphigus. She's got tons of eosinophils. All the pink dots, those are eosinophilic granules. She's pretty severe.
The only way to diagnose pemphigus is to biopsy her, but she's already been biopsied and she's been through so much. I really just don't want to put her through that again. So I'm going to go with my gut and start treating her.
It looks like pemphigus. It's the most common form of autoimmune skin disease that I see as a dermatologist, so I've treated it lots.
Yeah.
It's generally not life-threatening, but it's lifelong. So I usually do a combination of a steroid with another anti-inflammatory drug or two, depending on how they do, so that I can get my patients off of steroids and not have to keep them on steroids forever.
Pemphigus is not curable, but with the medications, we can heal the skin. The crust should resolve, the hair should regrow, and she'll do just fine.
Just call me if anything, if anything changes with her. We'll just collect all your skill on this piece of paper here. It's not embarrassing. We're gonna help you.
I'm very, very happy that we found out what is going on. But we can start treating, get Natty feeling a whole lot better. Yes, ma'am.
Thank you
All
so
right,
much.
Thank you, guys. And I heard you had the Frenchie socks on.
I was like, I got to.
Yeah.
I got to.
Yeah, super cute. I love it. I love it.
Helpless was the word. But Dr. Joya, she's giving us some hope.
All right, honey.
Okay. Oh, I know. This is sweet Bowie. Hey, it's okay. I'll keep playing with your toy. It's okay. It's gonna help you. It's gonna be okay. Here he is. Oh, he's loose. What happened? It's okay.
We gotta clean his butt better when he's down because he stinks.
He's offended.
Pancho is my wingman. Come here. I'm a travel nurse. Been traveling around the country with him. He's got a sister. They keep me company. Just having them around really makes traveling less stressful. I woke up this morning and looked at his face, and it was all swollen on one side. I saw him last night, and I didn't think there was anything there. Then I went to go pet him this morning, and I noticed that there was a big lump on his face.
You got Poncho with you?
Yeah, I do.
Perfect. We'll get you settled in your room.
Come on, Pancho. I hope there's not an issue, and Dr. Joya can get his face back to normal.
Your dog is a cutie. Oh, one side of your face is puffy.
How long has that been there?
Oh, today. Like,
Just today?
Woke up and peeked at him, and I was like, oh, come here, Pancho.
He's very sweet. Oh, you're so good. Any, like, chance he could have had a wound or an injury
Well,
there?
his sister chews on his face.
Okay.
So
maybe
like,
some little puncture wound or something? Okay.
Yeah.
It could be soft tissue swelling from a wound or, like an abscess. We'll see if we can get some fluid out of it. And if we need to, we may excise it to let it drain to allow that pus and fluid to come out.
Things like this happen. It's not uncommon for dogs to play a little rough with each other. He may have gotten this from wrestling around with his sister and, maybe got a little puncture wound, and the swelling is now there because of that, but we can fix it just fine.
Look at how cute he is.
Oh my God. He looks like a bear. You took a hit to the cheek. Are you cute? Are you cute?
Yo. Blah.
I can try to stick a needle in if you think he'll tolerate that. You're strong enough? Can you do it? I know holding these guys is like holding a beast.
All right, buddy. You're okay. It's okay.
There's something in there.
You're being a good boy. Ah.
All right, Poncho. There's pus in there. This is bloody fluid, but it looks a little bit yellowish. It probably is pus. You might want to apply pressure.
Okay.
I'm looking at the bloody fluid that I aspirated from his face, and it looks like there's probably infection on the side of his face.
Oh, are you ready for your sedation? Sniff it? Smells like sleepiness to me.
Poncho's swollen cheek is likely an abscess from playing a little rough with his sister and got a little puncture wound. An abscess is just a pocket of pus, and his is pretty big, so we need to take care of it today.
I'm going to clean this a little bit. Could I have a light?
Hey, Mother, may I? We're going to try to remove this abscess, what I think is an abscess. I don't think it's a tumor. It's definitely a fluid pocket. There's bloody fluid in there, so I'm gonna do a little incision and try to flush all that material out so it'll heal. We're gonna block it with lidocaine. And he's sedated, so won't really notice it. Okay, ready?
Oh, it's coming.
Ew, what? Nothing happened yet.
No, I see what's getting ready to happen.
You do? Well, I'm hoping I don't see it because I don't want it in my face.
I've been around these enough to know that I'm not going to be front and center when she pops that. I'm going to take a step back and just watch it happen.
There is a pus pocket. I'm just not where it is. Where is your pocket?
Is it anything good?
Yeah, there's a pus pocket, but I think it might be like multifocal ones in there.
Poncho's face, we're hoping that there's going to be a big explosion of pus, and all kinds of goo usually comes out.
Okay.
But this is one that's probably a little bit older. It has multifocal areas of pus, and not one big explosion is going to happen today.
His tissue is very thick, and he has a lot of cellulitis on the side of his face. This is cellulitis that's causing all this swelling.
Cellulitis is infection that's deep in the tissue. I'm really glad that Poncho's dad brought him in today, because if we didn't know, this infection could spread, and it could have ended up being something more serious.
Now we're just flushing out the little pocket. Oh, God. All right, I flushed all the blood and pus pocket out.
I'm prescribing an antibiotic today to treat the infection so it doesn't spread, and hopefully we'll get him back to looking normal again.
Oh, sploot.
I think Poncho's sploot is the most adorable thing I've ever seen. His little legs just boop. It's so precious.
You run out of gas? Come on, Buggy. Come on. That's a good boy. Okay, come on. Gotta walk off those drugs.
He's so stinking cute. I literally can't form words at how cute he is.
He did so good.
He is a fan favorite back there. He's such a good baby. His skin is so thick, and there's a lot of cellulitis or inflammation in the tissue itself. So I left it like this a little bit so it will drain some.
Okay.
All right, baby. Call me if you need anything, okay?
Okay.
Bye, Poncho.
I'm happy they were able to drain the abscess, so that should clear up quickly, and Poncho's gonna be perfectly fine. But hopefully there's not too much drainage going home. I didn't bring anything to cover the car seat. I'm driving my girlfriend's car, so hopefully I don't send her back with a blood-stained seat.
Are you a good boy? Do you sit? Oh.
Hey, I'm sorry. I wasn't petting you enough. I kind of got the, like, hey, pay attention to me, pet more.
I heard you had the cutest little Mojo in here. Oh, it's the smallest little thing. Hi.
Oh, little Mojo. When I see little cutesies like he is, it just makes me want to put them in my pocket. Like he's the tiniest, like, bite-sized dog.
His little Yorkie mix?
Shih Tzu, Yorkie, we're getting ready to do a DNA.
Oh, you are fun. I think Mojo's probably a teacup something. He looks sort of like a Morkie to me. Those are Maltese Yorkies, but he's perfect the way that he is. So how long have you guys had Mojo? I understand was really sick. He was really sick when you got him.
Came from a hoarding case.
Okay.
Horrendously neglected. Mojo is an absolute miracle. Can you say hi? Say, I'm sleepy. Y'all cutting into my nap time. The day that I picked Mojo up, he was in critical condition. He was emaciated. He weighed 1 pound. Skin splitting open, chunks of skin falling off of his legs, open wounds. We found that he had 2 broken legs, then the bones grew back wrong. But his front leg hangs to the side, deformed, and we didn't believe he would make it through the week. But he's a fighter. Miracles are still happening. He's fighting back. It's been a journey. It's been 5 months. He has beat all of the odds. He's just a part of us now. He is a member of our family. I don't think we could survive without him. I mean, we live and breathe him. Mojo. But he is not out of the woods. He has issues with his skin. When we got Mojo, he had one of the worst skin infections that we've ever seen. So he got a bath every night for 2 months and medicated shampoo. But we noticed that it just doesn't seem to be doing the trick. He has a smell that comes off of his skin. And I just feel that his skin is still unhealthy. If there is something we can do to make his skin healthier, we'll meet it head on.
You would never believe this is the same dog from your pictures.
I know.
And I mean, we probably don't even know exactly how old he is either, I guess.
Guess is between 6 and 7 years old.
Okay.
Oh, I'm sorry. What's those sounds you making?
Oh, his tail's wagging. He likes you.
But she's snoring.
Mojo. Oh. Do you think that he's itchy?
He does with his really strong leg. He does itch some.
With this spring coming, do you think that he's more itchy?
It doesn't happen all the time, honestly.
This here is unusual. I don't know. So this is where the hair has not come back.
Right.
And then he's got all of these blackheads.
Yeah.
Tons. Those blackheads, sometimes you can see those with Demodex mites.
Demodex mites are a type of mite that live down in the hair follicle, and they can cause hair loss and crusting on the skin. Because we don't really know what's causing the lesions on Mojo's skin, it's really important to check and be safer than sorry.
That causes an odor. We can give him a bath.
And he still stinks. So, I mean, he does have a little smell to him. Mm-hmm. He may still have some infection. Has he been skin scraped?
No.
Okay. I'll take him back and do that.
I'm not really sure what's going on with Mojo. He's got a lot going on with him, and I'm gonna start with some cytologies to see if we can figure this out.
We're gonna get you feeling better. We'll see what's going on with this belly. All right, little baby, I'm gonna put you in my pocket. Oh, okay. All right, just be a few minutes, okay?
Okay.
All right.
Want to see my Mojo?
Ha ha ha. Can I hold you?
You need some Mojo.
Oh my gosh. Can we make him our clinic dog? Get
We
him
could have a clinic
all
dog.
better.
And he just lives in the clinic?
He lives in the clinic.
Like a cat.
In my pocket. Mojo was so precious. I mean, any little teeny dog that comes in, you just have to hold. He has totally brightened my day. Who doesn't want a Mojo in their life?
It's great.
What's up?
Where all these blackheads are.
I know. The littlest dogs are the squirmiest.
Looks like a teddy bear.
Maybe hold that little leg.
Everybody grab some puppy.
I'm not sure if this is mites or if this is infection that's causing the skin lesions, but whatever it is can put a little bit of extra stress on his body and suppress his immune system a little bit. So we have to figure out what this is because he's got a lot going on and we need to get him feeling better.
Look at these skin scrapes. I don't see any mites, so that's good. Wait a minute. All right, looking at Mojo's skin slide, we've got some bacteria. He also has a little yeast, which can make him smelly. Bit of infection.
Mojo does not have any mites, which is good, but he does have infection on his skin. He has both bacterial infection and also yeast infection, and both of those things can sometimes come up when you have something going on internally that's suppressing the immune response.
This is a little antibiotic shot.
You're gonna have to be very brave, okay?
So I'm starting Mojo on an oral antibiotic as well as an antimicrobial that'll take care of bacteria and yeast for him. So I'm hoping that that resolves his infection.
All right, here he is. I did scrape a couple spots, so you'll see a few little red raspberries, but I didn't find the mite. And then I did do a slide from his skin, and I found that he has bacteria and yeast.
Still there.
So that's probably why he has a little bit of the odor. So we'll put him on an oral antifungal, and then we gave him a little shot of an antibiotic injection. I mean, there could be something else that's going on. You know, with blackheads, like sometimes it's representative of something going on internally. You can see it with different endocrine disorders. Our thyroid is necessary for initiating anagen, which is the growing phase of the hair cycles. That's something that we should probably look into. You can have your family vet draw the blood panel. It's totally fine to do. And I usually do a full thyroid panel because sometimes just doing a snapshot look at it isn't a complete picture and it can be a little confusing.
So I'm working on treating Mojo's infections first, but I do think it's a good idea for us to have some blood work done so we can make sure that there's nothing internal going on, such as thyroid disease, because diseases like that can cause them to have recurrent infections and also make their infections difficult to treat.
Bye, Mojo.
Bye-bye.
You brightened my day, Mojo.
I feel hopeful with Mojo with his skin. What we can't see with the eye, she found the scraping to find all the bacteria. So yeah, I'm feeling really positive. He'll come back here in a couple of weeks. Hopefully this is gonna help. That's another step in the right direction. You don't take a lifetime of horrendous neglect and cure it in 5 months, 6 months, 7 months. But we are up for the challenge. We're gonna give this baby the best life that he can possibly have.
Come on, girl. No.
Slow down, girl. It's like the complete opposite of last time.
Right? We brought Natty back today and see how she's doing.
Hi, Natty. What you doing? Hi.
You look a little bit better, I think.
She's not itching nearly as much. Her hair is growing back.
She's playing with our other dog, Sadie, again.
Good to see you all playing again.
Natty's getting back to her old self again, and it's amazing.
Yeah, we're gonna go right in here.
You went too far, sister. Come on.
Hopefully, when Dr. Joya sees Natty, she's gonna be just as relieved.
Look at you. How are things going?
Good.
Where did all your hair go? What happened to you?
Natty's the cutest little French bulldog. She had crusts all over her skin, almost zero hair.
So she looked normal at one point with hair and everything.
Yes.
All over.
I diagnosed her with pemphigus and started some treatment, and she's back today for me to take a look.
The meds going okay?
Really good.
Okay.
1, 2, 3.
She's a little bitty thing. Let's see. Let's take your little bra off here. Let me hold you up real quick so I can look underneath you.
Oh, Natty.
Oh, you look so much better. But even her foot pads, they're looking better. Like
Oh,
they're
yeah.
softer.
All your crusts are good.
She's back to playing and
Great. very good. Natty looks amazing today. I mean, she's not perfect, of course. She's still very bald.
Now you just need hair.
This is Daddy's baby, so he needed his baby girl back to normal, and she's almost there. I do see little peach fuzz, so that's awesome.
Going backwards, you feel it.
Yeah, you do.
And
You feel
It seems like as the days go by, it just more.
Yeah, especially with pemphigus, it might grow back in a different color than what it was before, so you could see that. I had a white dog that we treated many years ago during my residency, and it came back as a redhead after. I'm hopeful that over the next couple months that she's going to continue to improve and have hopefully a full coat of hair soon. So we just need to give her a little more time. So, I mean, our plan is kind of to stay the course with the cyclosporin, because that's what I'd like to maintain her on over us having to keep her on chronic steroids. So our next step is going to be to try to taper the steroid down and then see, you know, where we land on as far as her long-term dose.
Pemphigus is very difficult to treat. It does require lifelong medications to suppress the immune response. But if I can control Natty's disease with other medications, I should be able to taper the steroid down to a very low dose.
I'm really pleased with where she is. It takes a little while, but already not having the crest and not being like fire engine red is a very big plus. You've done a great job with her. This is one of my favorite diseases to treat. I like it because sometimes it's misdiagnosed and, you know, it takes a little patience to treat, but when you get them on the right treatment, they do really well and they look great.
I think we're getting where we need to be with Natty. I really do.
All right, little princess.
Are you ready to
Thank you for coming in to see me. I've been thinking about her.
I mean, it feels great to know that everything's going really good.
When I come home from work, now she's jumping at the gate, whining, crying like she used to. She's happy to see you.
Hi, Nene.
That's our old Natty.
Come on.
Good boy. Good boy.
That's a good boy.
You're so sweet. You're so cute. I can't deal.
Good morning.
Good morning.
You got Maggie May here?
I got her.
Perfect. Well, if you'd like to follow me, I can get you settled in a room.
All right. I brought Maggie May in today. She's all healed up, and we're going to find out whether Maggie's tumor was malignant or not. Hopefully, this is going to be good news.
Let's see this little baby, Maggie.
How are you?
I'm good. How has she been doing?
She's doing great.
Everything healed okay?
She's picked up a little bit of weight.
Good.
Maggie May had a suspicious-looking tumor that I removed.
I don't know if it's a form of mammary tumor, so it could be like breast cancer.
I did not like the look of it, so I sent it out, and I have the results today.
It's not just fat. It doesn't look good. So I got the report back, and it's kind of one of those good news, bad news situations. The bad news is it is a form of cancer. It's a type of mammary carcinoma. It doesn't actually go to distant sites, so it shouldn't metastasize or spread anywhere internally. So it's unlikely that it would go to the liver or the spleen or anywhere else. So, you know, we just need to monitor the site for local recurrence. This is the best news that we could have, you know, with something like this. So it is cancer, but it's not a cancer that should take her life and go, you know, somewhere internally. So
Awesome.
That's really good. Yeah.
That's great.
Yeah. And at this age, I mean, you know, that's great. You would never guess she's 13. She doesn't look like that.
I always hate to give the news of cancer to a mom or dad, but in Maggie's case, this is somewhat good news. It is cancer, but it's a type of cancer that's unlikely to spread internally to other parts of the body. We're gonna have to keep an eye on it, but I think that she's gonna have plenty more time with her dad.
I can tell she loves you.
Yeah.
That's Daddy's baby.
I'd love to have her around for another 5, 6, 7 years.
Yeah, absolutely.
She's the lovingest dog.
You know, at this point, it's really just about, you know, keeping her as happy and healthy and loving on her as much as you can.
If I'm home, she's in my lap. I'm like one of those big guys that's got a little chihuahua in his arm, and I never expected to have a 5-pound chihuahua, but I love her. Maggie's my baby.
My sweet girl. You just go home and be loved on by your daddy.
That's all she wants.
She's so sweet. Looks like a puppy. You're forever young.
I'm optimistic about it. Dr. Joy has said that it's the kind of cancer that will stay in the one spot. So I really do believe we're going to have Maggie May for many years to come. All right, Maggie, let's go home.
How's little Mojo?
He's doing great.
Hi, little buddy.
When I first met Mojo, he was a sweet little rescue that had come from a horrendous situation, and he had terrible skin lesions that turned out to be bacterial and fungal infection.
This here is unusual. I don't know.
We've been treating that, and I think that he's been doing a lot better, but I can't wait to see him in person.
Hi. I've been so excited to see you.
Right.
Oh, little Mojo. He looks so much better.
You look so good. You look so clean. Mom does a good job with you.
Look at all this hair you have. He's just a little red through there, but you're doing a great job with him. And he's very well loved. Very well loved.
Mojo looks great today. I'm excited to see that his hair is regrowing, that he doesn't have any lesions on his skin, and he's more active, and he just looks wonderful, and he's doing well.
Has he gained weight? He looks bigger.
He's gained four more ounces. The last time that we seen Dr. Joya, she recommended some blood work be done with his primary physician.
You can have your family vet draw the blood panel. It's totally fine to do.
And I usually do a full thyroid panel.
Luckily, we found out that he had an extremely underactive thyroid. And now he's on medications for thyroid, and he's doing great.
That's such great news that we figured out that he had hypothyroidism, because that was one of the things I was thinking, you know?
His skin isn't flaking anymore, retaining his body heat.
Yeah, good for you. Does he have a little more energy?
Oh, you wouldn't believe it.
Mojo does have hypothyroidism, but this is a very treatable endocrine disorder. It's a disease where the thyroid produces too little hormone, and if you supplement it, they do quite well, and they feel so much better, and it can really make a huge impact on their quality of life.
Oh, well, thank you for bringing him in. You do just such a great job.
Thank you.
He's doing great. I mean, his skin and hair coat feel wonderful. Continuous topical therapy, and if you have any issues, if you notice any skin problems or any itchiness in the future, I'm here to help.
It feels great to be part of Mojo's story. He's kind of a larger-than-life character in a tiny little dog body, and it's just great to be a part of that. To see Mojo living his best life now with so much care and attention is really great.
So sweet.
Mojo is doing great. We didn't think he was going to live a week, and he's still with us and loving life. The infection is completely cleared from his skin. There's no more fungal bacteria. And now he's on medications for thyroid. His energy level is through the roof. He's doing great. And I hope Dr. Joya understands the impact that she's had on his life, catching, you know, what his illnesses were. It's just made all the difference in his little world, and he's living his best life yet. Okay, buddy. Okay.
What's up? What's up? Come on. What's up, my nose?
In the past couple months, Natty has done a 180.
Say hello. Natty.
Before, Natty literally was bald.
Your hair's gone. You got these crusties on your skin.
She had lesions all over her body. Her attitude was down in the dumps. She didn't want to play. She didn't really want to eat. She didn't want to do anything but just lay and sleep. But now, she's back. Her hair is coming back. Her attitude, everything is just amazing. Now, Natty wants to play with her sisters, go for walks. She loves her tennis balls.
Good girl.
As of our last visit with Dr. Joya, we have cut off one of her medications, but we will still have to keep her on one pretty much the rest of her life. She's not a fan, but she does take it. She'd be like, oh, man, not again. But she's like, go for it. What's a walk around? I think she knows, in a sense, if I take my medicine, I'll be happy and healthy. And I don't think it would have been possible if we didn't go see Dr. Joya. She helped us out, and I'm just thankful.
Good catch, babe.